Epilepsy affects 1 in 100 people. When epilepsy is controlled, which 60% of the cases can be controlled easily, or they're cases that you'll outgrow, or they're due to a simple insult like an acute injury or some type of toxic or drug reaction. The ones that are more due to brain malformations, genetics, intractability, those are our challenges, and that's where epilepsy specialists like myself come in.
I remember very clearly telling Dr. Ches that I would be okay if Evan had 5 seizures a day because he was having 40. So I was like, okay, I could deal with 5. If that's what we're gonna have to deal with, then that's fine, we can deal with it. And Dr. Ches said, well, I don't want him to have any. So even he wanted, more control than I did, only because I just didn't feel at that point that I could even expect no seizures. Dr. Ches said, let's see if he's a candidate for the laser surgery.
I actually brought the laser surgery out here when I saw it first being developed because I felt that it would offer patients who have very difficult to remove lesions, or they're in parts of eloquent brain that if you just go next to them, you could hurt them and lose a skill like motor function or speech skills. But the laser can be so precise and have such minimal invasiveness that it allows people to feel less afraid to have a surgical option.
My job is to make sure that an area of the brain that's been localized as being the seizure area of activity can be approached anatomically so that we can get through important eloquent areas that have a significant function safely and not hurt them, and to put probes wherever they need to be for appropriate monitoring during the procedure.
What we have, which is one of the reasons for its success, is the multidisciplinary approach, because these laser patients have basically the best of the best when it comes to their neurology services, neurosurgical services, OR staff, MRI staff, advanced imaging techniques, and neuropsychology testing. All these patients get a neuropsych testing before and after, so we can see that based on cognitive abilities, not only it has not decreased after laser, but most of the time it goes up because the patient stops seizing.
Evan did great. He was in the hospital at Sutter Memorial less than 24 hours. He was acting fine and just happy, and not like he'd had brain surgery or laser brain surgery at all. For family members that don't see him very often, I still almost a year later get, oh my goodness, he's doing so well. He's talking, I can understand him. And we're probably about 18 months seizure-free right now.
It doesn't seem to matter how many years people have had seizures, we can still cure them. That's a huge benefit to somebody who always fears like the other shoe is going to drop. They're socially going to be looked down upon if they have a seizure in public. They don't feel like they have the ability to go out and do the things that they would want to do. So when you give them their life back like that, they really feel like they've got a new take on life, a new outlook. And I think that's one of the greatest things that we can give them.